never give up. I never give up. I never give up. Turn around.
Hi guys, welcome back to Neff Inspiration, a show on YouTube and as a podcast with me, your host, Stephan Neff. Today is going to be an amazing interview. I have got Satya Sardonicus with me. Satya is a woman who, for a long time, had suffered a number of weird signs and symptoms that were a bit of a chameleon and were a bit of a completely changing things. She sought help because, as so many of us, we are suffering from things that are labeled at one stage, maybe fibromyalgia, maybe chronic fatigue, maybe weird and wonderful other syndromes, anything, because we as patients and we as doctors, we like to put labels on things and put people into little drawers so that it fits quite nicely and that we can then give the right medicine or do the right cutting and cut things out. But what if that is not so straightforward? That nowadays is unfortunately far, far, far more common. And Satya is an amazing example. But more importantly, she has found ways where a knife was not necessary for something that really normally you would operate on. And she has found ways of looking at her body in a very, very different way. So today we're gonna take a deep dive in the world of the fascia and a world of movement as truly therapeutic exercise and as a way of reducing symptoms so massively that conventional doctors sometimes say, how the hell did you do that? And I can't wait to talk to you. Satya, welcome to my show.
I'm so happy to be here. Absolutely.
Goodness. Satya, how old are you now?
I'm 40.
40. You are cheating. There's no way. You're looking stunning, okay?
Thank you.
And there is a smile in your face and there's a sparkle in your eyes. And that is probably a very different Satya compared with the Satya that you were starting to be age 18 or so when your first symptoms sort of came on. Tell us a bit about that story.
Yeah, I actually I first had a drop attack collapse when I was 16, where like fainting, but I didn't lose consciousness, just all of my muscles turned to mush. And I was told by the doctor I was seeing at the time, a naturopath, that I had the worst case of adrenal fatigue he had ever seen, and at the youngest age. He said much worse than med school graduates, which is saying something. Having gone through that process, we know. And he said I just needed to do less stuff and gave me some tinctures, herbs, Chinese herbs to support my adrenals. But I went on to develop headaches, dizziness, nausea. Like my siblings always thought I was faking because I wanted to sit in the front seat. But I really, even as a teenager, really had a hard time with car rides. And interestingly, we didn't realize until a lot later, but we think the symptoms really started when I was 7 after a car accident. But the only symptoms I had when I was young were things that my parents just thought were part of my personality. Things like being hypersensitive, like getting into more arguments with my siblings. Like I was very contentious and needed to like control my environment a lot. So, it's interesting because we realize now that's probably because of the car accident I was in when I was young, where I ended up with 3 disc herniations in my neck and one in my low back. We were in a stopped car at a red light, and some guy didn't see the light, and he rear-ended us at about 80 kilometers an hour.
Fuck.
And so I had these disc herniations in my neck and low back, but my dad is a chiropractor and my mom is a craniosacral therapist. So I had really excellent structural care. And I recovered, we thought, but in retrospect, my dad and I were talking about this recently, that I wasn't actually asymptomatic before I was a teenager. I just had more like sensory processing and things that they thought were my personality. And now we realize it was actually the trauma. We think that's when my brain got herniated out of my skull, and nobody knew until I was 26. But I started falling when I was 16 and getting these symptoms. And then 18, 19, as you mentioned, is when I started having auditory and visual hallucinations. So they thought maybe I had schizophrenia because that's when it starts. But I also had progressive muscle weakness and electric shocks down my arms and legs. And like my left side was really droopy and my right side was twitchy and spastic. I had what now would be diagnosed as POTS, where I would be just, my heart rate really did not regulate well. I could be sitting still and it would go up so high that I would start to pass out and then drop down so low bradycardic, and nobody knew why. It was wild. By the time I was in my mid 20s, I was falling. In the beginning, it was like every 6 months, but by the time I was in my early mid 20s, when I was actually in graduate school, I was falling 20 or 30 or 40 times in a day. And I would just not be able to move, which all my muscles includes for breathing and talking. So I couldn't move or barely breathe for 30 seconds to several minutes. And now I go, oh, I was having a dorsal vagal collapse, like going into a freeze. My brain just was living on the edge of that all the time. Sometimes I could tell it was triggered by like a door shutting sound, getting startled by a sound. But oftentimes I had no idea what the trigger was. And I was even used as an example of like in neurodiagnosis of all the pathological reflexes because I had every one of them. I had all of them, like it was
Shit.
they're like, we don't need to watch a video or read a text. Like, just do the test on Satya. Like,
Oh, God.
it was crazy.
Now, I need to stop you there. For me, as a doctor, you are talking a language that I love, just to the point. Just give me all the right information there. Half of the other, well, not the other, many of the listeners and viewers will think, what the hell? POTS? What? Parasympathetic? What? Vagal? Huh? So let's talk a little bit about it. So two things that you guys need to remember. There is the fight and flight, the sympathetic nervous system. And on the other side, there is the more healing, restorative vagal nerve and the parasympathetic nervous system. So yin and yang, you need both of them to survive. And if you are in complete kilter with that, that's not very clever. Most of us in sympathetic overdrive, and that's where then all the stress results in issues that often then lie in the tissues. So that is that one side, and the parasympathetic is this wonderful, beautiful healing system that we have that is so underutilized and that we want to strengthen. So as a rule of thumb.
Can I
Yeah.
add one tiny piece to that? Because you said it's not very clever to be in sympathetic, but I think it is actually the most intelligent. That the brain, when it thinks it needs to be in survival mode, the things that happen in sympathetic dominance, like more cholesterol in the blood to make more stress hormones,
Oh,
more like a higher heart rate to get the blood and blood pressure to get the blood out to the muscles, decreasing the fertility and reproductive function because it's not safe to raise children in an unsafe world. These are really intelligent things. It's just that the brain is stuck in the adaptive response and we need to figure out why it's stuck there. But I get really, it's like my biggest point of contention with often with the medical community is that we go, oh, the body went rogue, or it's attacking itself, or it's glitching, or something is wrong. And I'm like, it's not actually broken. What if it's just in an intelligent adaptive response and we have to
beautiful.
figure out why is it stuck in that response?
Beautifully said. Beautifully said.
It feels
I was
suffering. It
no, no.
feels horrible. Yeah.
I was trying to simplify to get things. You are actually on the mark, 100%. Absolutely agreed. Um, POTS means your autonomic nervous system is all over the show. Now, it is. These systems are actually normally very finely calibrated and are really, really good. That's the reason that we humans have survived for so many hundreds of thousands of years. But the reality is, if there is a serious malfunction, then your normal responses, for example, you getting up from the sitting to the standing, well, now suddenly blood rushes down into your lower extremities. And normally, if there's no compensatory mechanism, your brain, not much blood goes there and you fall down unconscious. Well, luckily, that ear systems are designed to immediately sense that, change the way that blood flow is allowed to go. And so you maintain a perfusion of your brain and you don't get unconscious. And for that, your heart rate changes a bit and your blood pressure changes a bit. Clever stuff. But if that is suddenly
Yeah.
no longer working, then suddenly you have got syncopes. You've got basically someone collapsing, and
Yeah.
the heart rates go all over the show, as you indicated, which is no longer sensible or does no longer make any sense whatsoever. That would be POTS.
Yeah, I definitely agree with you on that. What I was suggesting is that if it's sympathetic dominance that is causing the symptoms, I am suggesting that that is an intelligent thing.
Mm,
But something like POTS can be caused by a mechanical disruption, which is actually causing a problem. Like, I'm not
mm,
saying that that dysregulation is always intelligent, although it might be the intelligence of the brain deciding not to prioritize that regulation if you're in
absolutely.
alarm. But it can also be the structural thing, which we can talk about. The condition that I have
Absolutely.
can cause that, and that is malfunction.
That's
Yeah,
true. So
yeah.
just I was just laying the land
The
here.
groundwork,
Just well,
yeah.
exactly. Just make sure that everyone understands what is happening. Because now we need to sort of talk a little bit more about the structure. And the structure of our body is beautiful. You've got this beautiful skeletal system that is, protecting things and holding things in place. And it is, again, very cleverly designed. And it's so beautiful. It's actually a wonderful, wonderful machine, a mechanical machine. The problem is sometimes whoever designed us, they are having a bad day. And sometimes there are little things that are not so great. For example, some people, the normal size of the canal within the spine, where the central nervous system and the spinal cord lies in, is naturally quite narrow, far narrower than in other people. So if you've got a narrow place and then there's wear and tear over the years, things for like that, for example, set people more likely up to have lower back pain. We see that in some indigenous people here in New Zealand, etc. So there are sometimes genetic factors that play in to set you up one way or the other. Equally, there are some things that are just very, very interesting, and they just come out of the blue, are often misdiagnosed, and I think we've got one of these symptoms, the Chiari malformation here, and that has plays such a major role with you. So let's talk a bit about that. So that's quite a unique and quite a very strange thing, but we need to talk about it because that was contributing to so many of the symptoms. And that led you to completely change your life. So tell us about that. You were saying herniation.
Yeah.
What means herniation?
So that's exactly where I was going to start, was talking about the term Chiari, because it's actually uh, an incomplete understanding, and a lot of the information that, if you just like Google Chiari malformation, you see something similar to what is taught in medical school, which is that it's a very rare congenital condition.
Yeah.
Oftentimes, like, the back of the skull doesn't close, the brain is falling out, for lack of a better term, like that it's outside where it belongs. So herniation just means something is outside where it belongs. The word ectopia also means the same thing. If you've heard of ectopic pregnancy, right? That means a pregnancy outside where it belongs. And so the term, as we as a scientific community are moving away from terms based on the person's name who discovered it and into more anatomical based terms, because Chiari is named for the discoverer of the condition. And there are, to clarify, several different types of Chiari malformation. But the thing that I'm going to focus is actually called Chiari type 1, which can be post-traumatic. It's not always congenital. And there's not a lack of closure of bone that's causing this problem. There's just the lower part of the brain, so the cerebellum is the lower part of the brain, and then the cerebellar tonsil is the part of the cerebellum that's at the very bottom. And the hole in the base of the skull, the foramen magnum, the cerebellar tonsil is meant to sit Different places say anywhere from 4 to 6 millimeters above the level of the foramen magnum. And what should go down is just the brain stem, right, which turns into the spinal cord. But instead, what we see is you can have the cerebellar tonsil be ectopic, so that it's, I know my other finger's in the way here, be ectopic, so it's outside where it belongs. And that's called cerebellar tonsillar ectopia, which if it's 5 millimeters or more outside, then it gets called Chiari. But it is not diagnosed as Chiari if it's less than 5 millimeters. Now, it doesn't take a genius to realize that a hole that it should only have one thing that has two things is going to reduce the fluid flow going through, is going to create squishing of the things, especially when you move your head around. Even if it was a 1 millimeter herniation, it's still going to cause those problems just from a physiological perspective. But it won't get diagnosed as a problem. And I've even had patients come in to see me. I had this one woman come in with headaches, dizziness, nausea, ringing in her ears, burning eye pain, and like visual migraines with visual aura. These are all very brainstem related symptoms. And I looked at her laying down MRI, which we can talk about. There's a difference between upright and laying down because gravity changes the position of the brain. And so that's another reason it gets missed a lot, is because we're taking laying down MRIs instead of standing up. But she came in with the images. I said, I want to actually see them, not just the report. I looked at the actual images. And I could see, even when she's laying down, probably 2 or 3 millimeters that her cerebellar tonsil was outside the skull.
Yeah.
And I started caring for her accordingly with these therapies that I developed that saved me from needing brain surgery. She started to get dramatically better. She went back to see the neurologist she'd been seeing for a year with no help and told him what I'd been doing. And he looked at her in the face and said, "This couldn't possibly be causing your symptoms. It's just your body decided to heal, that it's getting better. And what she's doing, what Dr. Sakti's doing, is ridiculous." Even
Priceless.
though, and he still had no idea what was causing her. He's like, we still don't know what's causing them, but it's definitely not that. And so many people end up with, whether they're told it or not, maybe on the report it says, oh, you have low-lying cerebellar tonsils or mild tonsillar ectopia, but they're told that that's not connected to their symptoms, which is ridiculous.
Oh, that's interesting. That's interesting. But there's so many factors here coming together. Oh, for crying
Yeah, so
out
it doesn't
loud.
get diagnosed if it's less than 5. And there was a study, a really interesting study in 2010 in the journal Brain, where they took 1,200 people with neck pain, no other symptoms, and half of them had a history of whiplash or concussion and half did not. I don't know where they found those people. I feel like so many people hit their heads. Even like when you're a kid, you're running around, like you probably got a concussion and somebody just sent you back out to play. Or maybe you went to see a doctor and they're like, you have a concussion, go rest. See me in 6 weeks, And they don't do anything about it. So there's a lot of undiagnosed head trauma, but that's a whole other thing. But anyway, the non-trauma group, they took upright on everybody. They took upright and laying down MRI on everyone. And they found that upright was 2.3 times more sensitive at diagnosis, which makes sense because of gravity's change of your brain position. But interestingly, in the non-trauma group, 1 in 20 people with neck pain showed some degree of brain herniation. 1 in 20 people with neck pain have some degree of cerebellar tonsillar ectopia, whether they know it or not. And if you've ever had whiplash or a concussion, 1 in 4 people with neck pain. And neck pain isn't the most common symptom. Headache is. And that study hasn't even been done yet. And it can be asymptomatic and triggered to become symptomatic by something small, like misjudging the edge of the sidewalk, small. So we have people who don't even realize they had an injury and their symptoms just randomly came out of nowhere. And it could be because they had this condition.
Interesting. And that is, of course, so important to recognize and realize, because here we see a classic example where a different understanding of a very complex situation is actually driven by patients and by healthcare practitioners such as you, who take an extreme interest into a perceived to be a very rare thing. Science and insights within a small community move rapidly forward, whilst the doctors, those people who are supposed to make decisions, are often left 20 years behind. And that's what you
Well,
see
isn't that
here.
it on average takes what, 17 to 21 years or something for any practice to get from the literature to clinical practice, right?
Yeah, you're quite right. And it's
Yeah.
so hard because so often we also get different clinical practices that are being implemented very fast and very aggressive, often because there's a monetary value there for doctors or for pharma industry or for other industries. And without the due diligence, without the due things, and then we see the complications arising from either the drug or from either the surgical technique or whatever is introduced in a very rapid fashion. So we see both
Yeah.
things in the medical world, and
Absolutely.
we need to be careful with that. And I think many wise doctors look at new things and say, okay, I hear that sounds interesting, but actually, you know what? I wait 5 years before I look into that more because I don't want to I don't want to
You
be
don't
the,
want to risk hurting somebody.
exactly. So
Yeah, I mean
you have,
that's why I looked at the surgical outcomes for this and I was like, first of all, the surgeries just sound barbaric, but second of all, the outcomes are not good. And even if people have good results, they often have other things continue to get worse, other symptoms, like it helps alleviate some of them, but not all. And then oftentimes they will backslide after 6 months or a year, and you end up in a multiple surgery situation and a lot of different medications. And because a lot of the pain is neurogenic, it's difficult to treat. And you can end up with the risk of addiction because of trying to manage the intense pain. I mean, I used to feel like light touch felt like hot glass ripping my skin open. I was asked to rate my pain on a scale of 1 to 10, how many millions of times? And for at least 10 years in my early 20s, I would have told you 25.
hmm,
It's intractable. It can be really intense pain having
hmm,
this condition. And you often don't get believed
hmm,
because they haven't found what they're looking, they're not looking in the
hmm.
right place. That's why.
And neuropathic pain means that is pain that is not coming from the bones or not from a deep wound in your skin, but it's actually from an irritation of nerves. Just again to explain things, and this pain is quite unique. It's often there all the time, waxing and waning. It's often worse at night. It's often described as with temperature. Someone is burning my skin. It feels as my hand is in a freezer. There are often signs and symptoms of nerve malfunction. It feels more or it feels less. And my God, if I bump it, oh my God, the pain is out of this world. And it stays there for 2, 3 days. I compared with you just hitting it now and it hurts, and in 30 seconds or a minute, it gets better. So there are certain characteristics of pissed off nerves that are quite unique. And you have experienced and suffered from that for 10 years, which is a hell of a long time.
Oh,
What
I used to go to sleep with ice packs and fans on my feet because I couldn't sleep. My dad said, "You can't do that. You're gonna give yourself frostbite." But I had so much burning pain
hmm,
that nothing would alleviate. And it was exactly what you're describing. It was this neuropathic pain. Yeah.
what led to the change? What led you to start exploring? So obviously, someone finally made a diagnosis.
Yeah, I mean, I went to get an MRI. They were looking for multiple sclerosis plaques in my
Yeah,
brain because they
yeah.
thought that's what I had. This gets misdiagnosed as fibromyalgia, chronic fatigue, multiple sclerosis, functional neurological disorder, all
Mm.
sorts of things. And so they were looking for MS plaques in my brain, but where I went to school, they had an upright MRI.
Ha
And
ha
so
ha
they were
ha.
like, "Well, you're doing an upright MRI." I was like, "Okay." And then then they said, oh, turns out your brain's sticking out the base of your skull. And so when I finally knew what was going on, then of course the options are they try pharmacology, but it doesn't go well. But their surgical options are to either remove the back of the occiput, the bone in the back of the skull, maybe also remove the back of the first couple bones of the neck. And I was like, won't it keep falling? And they're like, well, we put some netting in there. I was like, that doesn't sound good. And then another one wanted to cut the filum terminale, which is the attachment between the sleeve around the spinal cord to the tailbone. And I'm like, then my spinal cord's just gonna dangle? Like that also doesn't seem good. Um, and there's another surgery where they want to actually like kind of widen the hole in the base of the skull, take like a router machine to it and just make the hole wider, which again can have issues with it continuing to fall. But I was like, well, what are they trying to accomplish? Right? Because clearly, like somebody didn't come up with this because they're barbaric. They came up with it because they're trying to help their patients. I understand. They're like, what can we do? And I was like, all right, I think they came to the wrong conclusion of what to do, but they probably were on the track of something with the mechanism of what's wrong. And so I was like, okay, they're trying to alleviate the squishing of the skull onto, compression, and they're also trying to alleviate the pulling in the spinal cord and the dura, the sleeve around the spinal cord. And so that really led me into the world of fascia because I was like, how can I find the connections in the body that are further away because I had too much pain to even be touched in my neck? I couldn't, like, traditional chiropractic care was not going to be a good solution for me. Like, I could barely touch my own neck, let alone let someone else do it. I tried, but it didn't go well, which is also kind of classic with this condition that things, you know, things that should be a gentle manual therapy you might think would help can be really triggering. But I was like, okay, well, what's attached to the dura? Like from the tailbone, you have the ligaments that go out from the tailbone to your sit bone, and then fascia, the spiderwebby soft tissue that is the scaffolding of the body, goes down the back of the legs and into the plantar fascia at the bottom of the feet. And so I did a bunch of different experimentation with me as the guinea pig first, and then I've been able to do this with a lot of other people, and it led to I published a study in the Canadian Pain Journal in 2015, I think it was, showing a reduction of headache frequency and intensity, not just in people with this condition, but people with headaches in general, by addressing this structure, which I coined the term the dural fascial kinetic chain, because just like pulling on the edge of a bed sheet, it puts tension through the whole system. And like if my stockings were falling down, I can't just pull them up at the waistband. I have to start down by the ankle and feed the length up. And I did the same thing with the fascia. So if we feed the length up the fascia, it reduces the tension into the dura and into the spinal cord and alleviates a lot of symptoms.
Ah, okay. Now, that is an intriguing response to my question, but it makes a hell of a lot of sense when you actually, with the understanding that I nowadays have as regards to the contribution and often the causating influences of the fascia or of problems with the fascia. We've always said
so it's one part of it.
Indeed. So we often say that the issues lie in the tissues, and therefore there is so much movement out there with regards to the use of trauma-focused yoga, with regards to systems that are focusing on relieving muscle tensions, and nowadays we understand also shifting the way the fascia regulates up, forth, and back, and which suddenly releases probably sympathetic nervous system and other responses. It just changes. We are talking about a big spider web, so to speak, and we are starting actually to pull somewhere here over there on the spider web, but the whole spider web moves as you have described with the fascia, starting from the feet up, and everything moves in the body. We see the body in its own right in the same way, with regards to hormonal regulation, with regards to, in the past, for example, let's say gynecological problems. Well, the woman goes to the gynecologist who looks at the gynecology and down there, and then maybe she looks a little bit at the hormones and
Isolated with the blinders
correct,
on.
correct. And then there are other people who have got more tummy problems, so they go to the gastroenterologist and they get some interesting labels there, but not necessarily much help. Not realizing what we nowadays realize in functional medicine that everything is interconnected and
It's so
that
interconnected. Yeah.
yeah, absolutely. And so it's amazing to hear you having all these very severe symptoms, life-threatening, because a drop attack can also result in you actually banging your head and causing a bleed and having a traumatic
Not
stroke.
breathing. Hmm.
Breathing, well, exactly. There's a little bit of,
Breathing kind of important.
well,
Heart, like, yeah,
exactly. The
yeah.
heart rates,
So
come on.
there was
You
a,
know,
I mean, in my early 20s, I'm gonna get really emotional about this, but like all my doctors, my parents, me, we all thought I was dying because everything was just progressive. Like the progressive muscle weakness alone
hmm,
could cause me to die,
hmm,
when I stopped breathing.
bloody hell.
And the DFKC, that dural fascial kinetic chain, is a huge piece, but also there's like I could barely be touched even to do that. And so a lot of the fascia people that are getting excited about fascia release are often causing more nervous system dysregulation
Hmm,
because they're silencing the body's voice. Just because something's stuck doesn't mean it's ready to release. And especially if
hmm,
you've had trauma, like there's such a strong protective function of the fascia that it really needs to be released in a specific order of operations that starts with change receptivity in the first place, which when the body's in protective fight, flight, alarm mode, it's not interested in changing. Just like when you feel attacked in an argument, you don't really want to take over their point of view. Even if later you're like, they made some good points. But in the moment, if you feel attacked and the cells are the same, the tissue is the same, if it feels forced, it's just going to resist and associate that change, even if it's quote unquote a good thing, like loosening something stuck or reducing tension. It's going to associate that with danger, and it's going to snap back. So you go get a massage, and then an hour later you're tight again. This is why. And then it's
hmm.
going to resist that change in the future. It just ups your nervous system dysregulation. So you have to do both the nervous system regulation and the fascia release in hand in hand.
Which makes a lot of sense for me. But for most people out there, they would say, wow, that's so abstract. You have just lost me here. How the hell can I do that? Do you want to do it on me? Shall we do an exercise now where we can start maybe um, as a demonstration, so to speak? I'm more than happy to be a guinea pig. I'm more than happy to say that I have got a lot of shit going on in my life. So I'm sure that my fascia are very much in protective mode. In fact, last year I became a flexibility coach, and I'm stiff as a brick. Okay, so that's so much for the flexibility. But
Well,
it just shows that there are a lot of things dysregulated in my body as a
yeah.
response, and I accept that. There is no way that I get myself into a funny pretzel position just to demonstrate to you that I'm a flexibility coach. I would hurt myself, and I would suffer the pain, and that's just stupid. But it is can we show how we can make actually a slight bit of a difference? Where can we start pulling on this big spider web to
Yeah.
improve?
Yeah. So the first thing there's some context that I need to give, because the thing is, all these different kinds of therapies and methods and tools that are out there are pretty much skipping right to step 3 of 5 that I think are necessary for change to happen in a way that feels safe and actually sustains, that actually lasts. So I will share with you what the 5 steps are, and then we'll talk about how to modulate and a couple tools you can use. So step 1 is to actually establish safety. At least take the edge off the alarm, right? Like you have to create some change receptivity in the nervous system. And I'll show you a tool to do that in a minute, like a fast, easy one. Then you need to facilitate a softening. And oftentimes this happens automatically when you feel safe, that the body softens. But sometimes there are visualizations or meditations or different things you can do to invite the body to soften, to release its grip a bit before you try to then go in from the outside in, whether that's with my hands or a provider hands, do the change. Then you do step 3, which is the change, the release, the whatever you're trying to do. But I put a huge asterisk on it. You're going to only do as much change as your nervous system can actually tolerate and integrate. And it's not about your pain levels. People think like, oh, like sometimes it's just going to hurt. And I'm like, or different pain tolerance. Like,
Yeah.
it's okay. You can do it. Just do the thing. But if your nervous system goes into sympathetic, into that alarm mode during the change process, that's what's going to give you that boomerang effect and
Yeah.
make you need a lot more sessions. Also, it's like very inefficient.
Uh-huh.
So I can that that exercise is a little bit more complicated. Like, it's emotionally intense. It's a more complex process to learn. But I actually let me think about that. Because I teach people like how you can feel the physical signs of your sympathetic nervous system getting engaged, but it's like a musician learning how when a note is a little sharp or a little flat. It
Yeah.
takes practice. I don't know that we can do it in the container of this call.
Sure.
But I can shorthand it as, you could, if your heart rate goes up or some symptoms get exaggerated or your breathing gets more shallow. There's there's themes of constriction, and everybody experiences it slightly differently in their body, which is why, and I have like an online member platform where I take people through the whole method to do at home. And that's the first lesson, is like, here's how to learn your body's signs of that sympathetic engagement. But basically, if you're a provider, I teach providers, you can feel it in someone when you're touching them. Like, you can feel different signs of their tissue changing tone. You can put a pulse oximeter and watch their heart rate. There's different ways, but you're going to do whatever change you're trying to do only to the level that the nervous system doesn't go into sympathetics.
Yeah.
Okay. And then you got to even if you didn't completely loosen it or change it or whatever, because you just want to do your nervous system's capacity to process that change, then you reestablish safety. Then you integrate and adapt and practice at that set point. Like when you take the training wheels off your bike, you need to take go around the block before you're not wobbly anymore. So you're going to basically have your brain make a new set point of self, because the brain has an idea of what the body is. And you need to adapt to the new set point before you can then concentrically go through this process bigger and deeper. And that will really up spiral the process in a way that you're not trying to loosen everything in a session. You're trying to get the ball rolling and move your nervous system into healing mode, from alarm to healing. And it should actually continue to unwind in between sessions. So you're not just loosening, coming back, oh, I got to loosen it again. And you actually make progress. So there's 2 things I can teach you right now. One is a very simple way to assess where your nervous system is at right now in terms of its autonomic fight or flight balance, which is peripheral visual field gets reduced when you're in alarm mode. That's just a normal thing that happens. But at rest, we are meant to have 180 degrees of peripheral vision. So I'll step back and I'll show you. I often tell people to like stand in a doorway with their arms on the wall, then you know you're at 180 degrees. But you got to tuck your hair behind your ears if you have hair. Make sure there's nothing blocking your vision. And you're going to put 2 thumbs up and then put them back where you can't see them. And you need to be really careful that you don't look to the side with your eyes or your chin during this process, because that'll often happen unconsciously. So it's nice to do with a partner or in a mirror. But you're going to bring one hand at a time, bring your arm forward until you can see your thumb. Not a blob. You should be able to identify it has a thumbnail. And bring it as far forward until you can see it. I've had people be here, by the way. And then once you can see it, you're going to freeze right there, and you're going to do the same thing on the other side until you can see it. When I'm in my clinic, I actually use a tool to measure the angle forward, how many degrees forward from 180. But if somebody's doing it at home, you can just, take a note of like what picture on the wall am I near or whatever. You can guesstimate it. But if you're forward at all, you're in sympathetic sitting here at rest when there's nothing threatening you, you know?
I do it
So
other way around so that I can actually see the thumbnail. So looking straight on,
you want to see when
thumbnail
it disappears. Yeah.
about there.
Yeah. But you were looking with your eyes.
Yes, I'm looking straight forward.
Yeah.
Um,
Yeah. Yeah.
well, that's about
So
right. That's about right. Okay.
let's try
So,
something. Ready? So I have to ask you a quick little side thing that's going to come right back. So if you smash your finger, what's the first thing you want to do?
pull away.
Maybe curse.
Yeah. Pull away.
But
Immediate
also,
response.
yeah, but also you want to shake it, you want to
Yep.
squeeze it,
Yep.
right? Because
Absolutely.
both of those things, both deep pressure and movement, send these signals to the brain called proprioception
Hmm.
that turns down the alarm response. So when you smashed your finger, what's called nociception, alarm signals went to the brain. But then the proprioception signals from deep pressure and movement, they race, they go on faster nerves, they win. It turns down pain, it turns down the alarm response. This is the built-in mechanism to recover from an alarm trigger.
Hmm.
This is the same reason why we see exercise helping with depression.
Hmm.
It's why weighted blankets can be helpful for anxiety and sensory processing issues because those are related to the fight or flight response, turning down. It's also why a good hug can feel calming. And actually also why kids who have gym class in school test higher on their standardized tests than when they don't have gym class. They're starting to take it out of the programs here in the US because it affects cognitive function. Being in
Hmm.
fight or flight, your brain's like, I don't need to learn math or remember someone's name. I need to be in alarm. I need to be in survival mode, right? And so it's going to activate pathways for anxiety, depression, fear. It actually suppresses your ability to understand another point of view. Because if you were busy being compassionate for the tiger, you wouldn't fight for your life.
Hmm.
It's an intelligent response, but you're primed to those pathways of depression and heightened pain. Also being more sensitive to pain because your brain wants to make sure you're surviving. You know, if and like emotional memory, if anything ever brushes your leg again, it's like, oh, well, we might be in the field where I was attacked, so I should go back into that alarm response, right?
Hmm.
So that understanding of the natural mechanism to recover from alarm led to me saying, okay, well, most exercise, like most of the time we hear exercise fights depression, but also a lot of people with chronic pain can't go do exercise. Or if you have rigid places anywhere in the body, whether it's joint restrictions or tight muscles or fascia adhesion, stickiness between the soft tissue, any of that means the brain is starving for the proprioception that should be coming from those places. And instead, it's getting alarm signals. And you go for a run, and you're going to get good proprioception from the places moving normally, but any stuck place is going to get wrenched down and
Hmm.
send more nociception, more alarm signals. So
Hmm.
most exercise sends both proprioception and nociception.
Hmm.
Proprioception is how we can get the brain out of alarm. And if you have stuck places in the body, ultimately, you need to restore the neurostructural fluidity. You need to be able to get back to articulating through all of the places
Hmm.
fluidly. Just like a sapling in a storm, a young tree that bends all over is more likely to survive than a rigid one, right?
Hmm.
Strength, it's more likely to break. So we need that fluidity in our body. And
Hmm.
even if nothing ever stressed you out, you had a perfect diet, you were feel loved and surrounded by friends and family and children that never stressed you out and partners, and like everything is great, but you have stuck places in your body where there's either restricted joints or fascial tension or muscle tension that is sending alarm signals 24 hours a day. So the first thing we need to do is interrupt the loop with some proprioception. And that is like taking a vitamin. You can give your brain extra proprioception. And the easiest way to do it is with deep squeezes. So you're not using your fingertips. It's more like a wave motion with your whole hand. You can do this right now. And
Regardless
because
where.
it doesn't, I was just about to say that because proprioceptors are everywhere, the highest density is in the spine. So I'll also show you actually a spine focused exercise. I developed a series of exercises that take, I don't know, 5 minutes a day and will actually create more nervous system regulation because it feeds your brain proprioceptive feedback. But The squeezes is a really easy one. And if there's a place on your body that this hurts, skip it. It's a global response. The second highest density are in the feet. So if you're sitting down and you want to squeeze your feet, but also like I squeeze my hands, I'm not doing massage. There's a ton of joints in my hands. I'm just like deep squeezing soft tissue and joints. And what's really interesting that you may have noticed is that my voice tone just dropped and
Mm.
slowed down. And I didn't do that on purpose. I was getting
Mhm.
excited and all buzzy, but that's how fast the response actually is. That it creates a really fast. It's temporary because the stuck places are still sending the alarm signals, right? So ultimately, you need to loosen the stuck places. But this is a window in that'll allow you to go work on loosening the stuck things. Do a little experiment with me. Recheck your peripheral visual field right now. Do that. Let me see if it made any change. Sometimes it does, sometimes it doesn't. Wow.
Mm. It has.
Yeah, it has made some improvement. I love that. So it
Mm.
gives a window of access, and you can use that before you go to see a physical therapist or chiropractor or massage therapist, like, or even before you go to see your psychotherapist, because it improves change receptivity,
Mm.
which includes
So,
changing your mind.
so extrapolating from that, a mild. It's interesting to look at massage because there are so many different forms of massage out there. There's the deep tissue massage, which often focuses on very specific painful points. Ooh, I gonna get them. Let's get the
I'm gonna
elbow in there.
I'm gonna
Exactly.
make it loosen.
Exactly. And then you can't walk for 3 days. Yep, been there, done that. Um, and even losing my proprioception. I had one memorable time when this woman really went all out with my permission, and I said, you go for it. Come on,
Yeah,
make me
yeah.
lose." And I was literally wobbling down the hallway because my body couldn't actually realize where the hell is your set point
It was too
for
much change too fast.
exactly. So that
Yeah.
was just brutal, and I never went back there. Having said that, now putting things together, it makes so much more sense what had occurred to me at that moment in time. So, why do I say that? Massage is not massage. So, what you're doing, you could say, well, that's a mild massage, isn't it? So, therefore, is that the reason that a mild massage might be actually a good thing? Is that not
Uh,
something?
it is, yes, this is one of the primary mechanisms that massage can, when you experience benefit from massage, like if they don't exceed your capacity for change.
Gotcha.
Because what I was suggesting is that using this like not gentle, it is gentle, it's gentle, but
Hmm.
it's also deep. Like my fingernails are blanching when I do this. I'm
Right.
putting a significant amount of pressure. But but it's not pinpoint pressure. And I'm not trying to change anything. I'm not saying this is tight, let me loosen it. I'm literally, it's like a hug. Sometimes I call them squeeze hugs
Hmm. Okay.
because it's it's literally just like creating safety. So you can
Hmm.
use that for both step one and step four. You use it to prepare for change and also to integrate change. Now, the actual change I haven't talked about yet, although sometimes people have so much pain with being touched that that is a process that you need. The change is
Hmm.
even getting used to having deep touch.
Hmm.
So that's a separate issue. But
May I stop you
let's,
there?
yeah,
You were talking about the squeeze hugs, which makes a lot of sense. So using fascia and proprioception in parts of the body to address your parasympathetic nervous system, your balance
yes.
between sympathetic and parasympathetic. Automatically, I would combine that with a different version of breathing. I would, as a breath coach, I would say, look, let's try as we are doing that, I want you now to actually just take some nice, calm, deep breaths. Maybe even start with a few deep breaths.
I'm so glad that you mentioned deep breathing because we know that breathing is crucial and can have many positive benefits to helping our bodies, especially with therapeutic breath work, with meditative breathing, all sorts of different methods. And if your rib cage doesn't expand enough for breathing, that can be very, very difficult. So there's a really interesting phenomena that I've observed and that other providers who are doing this work as well have told me they're observing, which is that if you take a tape measure, a soft one, and wrap it around the rib cage up here near the top and also a lower rib cage measurement, and you compare what the circumference is of the rib cage when you breathe all the way out versus all the way in, it's often not enough. And I have to tell you in inches because I don't know it in metric, but what we're meant to see in an adult woman, general, or somebody with a smaller frame, we're seeing normal be somewhere between 2.5 to 4 inches difference from all the way out to all the way in. And in men or somebody with a larger bone frame, we're seeing anywhere from 3 to 4.5 inches be normal. And of course, there's the bell curve of normal, but what you want to do is compare also upper and lower, because often upper is not moving as much, and then the lower is relatively flaring. And this is going to not only affect your ability to do deep breathing if your rib cage is all gluey together, because what happens is the fascia is gluing the ribs together. And I think, here's my theory, is that the brain is, because we know fascia has a strong protective mechanism, I think that the brain is actually using the fascia to try to protect your vital organs when you're in prolonged alarm mode.
Exactly. What would you do? You would, in a fight,
So,
you would protect
yeah,
your
exactly.
arms.
You want to go into protective.
You're
Yes.
closing in, so to speak. And
So
therefore,
let's see how fluid yours is right now.
okay, let's go for it.
Okay, so I'm going to step back so you can see me a little bit. This can be done sitting or standing. I'm standing, you're sitting, doesn't matter. What you're going to, there's a little bit of visualization in the setup that I need to help you with. So you're going to imagine that you're like seaweed underwater, so you're very floaty, right? And your sit bones are kind of like the roots planted in the sand underwater. But also, you're between two panes of glass, so you don't move forward and back. You only move side to side. And what we're looking for, this is first going to be an assessment, but then I'll actually show you some ways that you can help it. But watch me do the assessment first so that you understand it, so that you don't hurt your neck, because it is possible to get hurt even in the assessment if you have a lot of rigidity in your torso. So the assessment is what I want to do, and I'll show it to you big so you can see the shape, but you're not necessarily going to do it big, is I'm trying to see, can I articulate from the bottom up all the way over on one side, and then from the bottom up, the head is the last thing to trail to the other side. But you don't want to do it so big that it starts to elevate your heart rate or hurt anything. What's really common, and you're going to do it several times, but what's really common is we see, oh, I'm moving, but then from about here to here moves as a single unit, like it's made of a stick instead of individual levels, and then the head wants to flop. And when I see that, that's telling me, especially in conjunction with the rib cage measurement, but you can also like feel your movement when you breathe. Right now, you could take your hands and just go take deep breaths and see, like, are your fingers coming apart? Is with your hands on the side that you're trying to feel, is my rib cage actually getting bigger? Or what's more common is if this is really stuck and it's insufficient to allow your lungs to inflate, you're using your accessory muscles to lift the whole rib cage, which so that you get that pressure gradient to allow the lungs to inflate, which means you're going to have chronic neck tension. That even if you get a massage and try to loosen it, your brain goes, no, I need that tight because it's doing a job. And compounding that with the side seaweed move, if you see that this is really rigid and then your head wants to flop, well, this hypomobility, stuck, not moving enough, means that there's a compensatory, the brain's trying to make up for it, hypermobility in the neck, which feels unstable and scary, and your brain uses the muscles to try to splint and protect your neck. So you're going to have chronic neck tension and pain. And the solution isn't in the neck, it's that you want to loosen the fascia that's in the rib cage. So let's try the assessment.
Understood.
Try doing your side to side. I call these seaweed wiggles because you're like
At the moment, I've got something more or less blocking me.
the sides of your chair.
Yeah, that's right.
That's okay.
Having said that, That's right. So I'm just putting my arms out
You can do
here.
it small.
Hmm.
So I showed it to you big so you could understand the
Hmm.
concept of it, but you
Hmm.
could do it small. I
Okay.
want to see, can you articulate
Sure.
through all of these levels? And you want your head to be the last thing that goes. Let your head trail. What's really common is people, without realizing it, lead with their head.
That's right. Which I was
They
just trying
actually,
to naturally.
exactly. So this is a nice thing to do in front of a mirror or with a friend,
Hmm.
because then they can help you see, and at the very least take your phone and like take a video of yourself doing it and then watch it. Um, so that you can really get a sense of, are you actually articulating, or do you feel that stickiness in the rib cage,
Hmm.
especially the upper rib cage? And if that's feeling sticky there, sometimes we can come at a release directly and just work on the rib cage. But what's really common, and why I don't want to show that to you here, is because so much of the time when I do that I've done that on podcasts in the past, I get people writing to me, I felt good in the moment, and then it flared my headache, it flared my pain, it flared my dizziness, my nausea,
Hmm.
my POTS, my whatever. And so the thing is, oftentimes it's, if you're not used to tuning into your nervous system signs of sympathetic engagement, you'll push past your threshold without realizing it and crash. But also, oftentimes, this can't be released first because we need to start pulling up the stockings with fascia release from the bottom up. And that process can take anywhere from, a week to 6 months, depending on how much trauma is in the body, how ready it is to change, how much change receptivity needs to be activated, what layers of trauma might come up as you're unraveling the fascia. So the lower extremities come before the rib cage. So, sometimes people can do that just fine, but especially for listeners that have chronic pain or dysregulation or things like that, I just don't want to risk it for you.
Absolutely.
I've
Makes
actually
perfect
been
sense.
yeah, I've been trying to share a lot of this information for free on TikTok, and I have been actually for the past 6 months or so. But I found I was just, in order to do a better job and um fully curate it and lay it out in a way that makes sense and allows people to go like only as deep as you can in the moment, knowing your capacity is going to increase over time.
Hmm.
That's why I created an online platform that's just a membership community for people to be able to go through that
Which is
process.
beautiful. And
Yeah.
you're quite right, because there is not a quick fix there. This is a new way, that's a new lifestyle. It's a new way of experiencing your body. And it's like let's say you want to learn a new sport, ice skating, and you have never ever been on ice. Do you really think that the first time you do it, you get it? And that the first
In a
time you
podcast?
yeah, that's right. Exactly. Exactly right. So that's
Yeah.
a very, very valid point. Even if it may make sense, and even if you get a little teaser, there is so much more. This is a journey.
Yeah, it's
And
not a protocol. I mean, so
correct.
much of medicine is based on protocols, but that's not how people work.
Hmm.
I think it's more like a choose your own adventure program. You remember
Correct.
those books when we were kids where it's, if you want this to happen, go to page 46, or if this, go to page
Ah,
51 or whatever, right? And so
out
I
of
actually
it.
built the program like that so that you can create, like customize it to
Yeah.
your own process,
If
because it's building a different relationship with your body.
isn't it? I mean, you had to now for those people here with the video, you saw me trying to do this exercise. What was your assessment of that exercise? I mean, it actually
Yeah, I mean,
felt relatively fluid. Um,
it's
and
interesting because I'm seeing your upper rib cage not articulate very well, and your head is kind
interesting.
of floppy. Like it goes, the speed of movement is like slow, slow, and then the head moves quick. Slow,
This
slow,
is
and
like
then
a dance move. I automatically want a dance move from the 80s, 90s here.
You
That
know
is
why? Because the way I developed these exercises was actually from a dance class that I took. I
exactly. So
it
automatically
started,
I want
yeah, it is.
to
And there are so many kinds of dance out there, but what I found with this, it was a contemporary jazz dance class, that what I found is, first of all, the I was willing to go in there and do things like 5% as big as everyone else, and sometimes be crying because not because I was in pain, although I was, but because the tears were like falling out of the stuck places. Like, and I'm in a room of mostly professional and pre-professional dancers. Like, that's not an environment that a lot of people feel confident going into. And I'm lucky I had a teacher that welcomed me in the class, even though I definitely didn't think I belonged there. But a lot of it needed to be adapted, and just like we talked about with other exercise, much of dance, especially because they're not focusing on your inner nervous system experience, it's it's got a different purpose.
Absolutely.
And so the movements can be really helpful, but having a very specific directed purpose, and that's around your nervous system and the fascia release, and having a relationship of like making sure you're not exceeding what your nervous system is capable of processing. Most times that you're dancing, you're in a different mode.
Hmm.
Yeah. But that's why you felt like you're dancing, because yes, I mean, this grew out of a dance practice that I basically combined my background in dance, yoga, neuroscience, and chiropractic, and like
Exactly.
turned it into, if they all had a baby, it would be NeuroFascial Flow Method. Like,
But it's so beautiful the way you describe it, because that's exactly what life is all about. And what healing is all about. We come from different places. Oh man, there's so much that has happened to me in my life. So many coping mechanisms that I developed that were probably not so great. Yet nowadays, my life, I can't tease it easily apart and say, oh, look, I want to be purely healing now. But no, there's the survivor in me who wants to fight. So you've got the dance. And for example, now with me trying to refine purpose and joy in my life, I have come back to using a long staff, a stick to work with. Now, if I wanted to do that with regards to martial arts, it would be bow fighting, staff fighting, stick fighting. If I wanted to do that in the sense of circus arts, it would be contact juggling. I can use the staff to also use in dance. Fred Astaire used all kind of props in the use of dance, for example. So for me, the ideal is to do a choreography where I bring all three elements together, from contact juggling to dance to martial arts, because that's
I
my
love that.
life. That's it.
Yeah.
And with
Yeah.
that, we can acknowledge and respect all those parts within us that have led us to this point in our life. That includes the trauma, the physical trauma that has impacted our bodies, the emotional trauma that has impacted our spirits. Plus, now actually say, okay, here we are right now. Let's move forward. And the emphasis is on movement, because here
It
movement
is.
is the therapeutic final path or the start of your journey.
And the
How
basis of all life.
correct. And I loved it because often enough, people focus on one aspect, the aerobic capacity. They go for a run and don't do anything else. Other people become gym bunnies and they only go for muscle tone
Strength. Yeah.
and strength in its
No,
own right.
we need that fluid adaptability.
Exactly. So
We gotta get back to fluid.
it's combining it all. If your
Mhm.
muscles are weak as little old rubber strings, well, then you can't be fluid because you're putting far too much strain onto the joints, onto the nerves,
Mhm.
etc. And you end up in fight and flight. So you need a
Yep.
muscle tone. So
Yep.
yes, but that needs to be in a healthy way, uh, combined with an aerobic capacity, because you need to train your chest. You need to train your abdominal muscles to actually learn how to breathe again if you have been
Yeah.
sedentary and sitting
That's true.
on
That's
your
the,
bottom.
you do the fascia release in step 3, and then you reestablish safety, but the adapt to the new set point. I will have people, once they do the fascia release in the rib cage, take deep breaths into expanding the rib cage. And if you feel your accessory muscles in the neck start to engage, breathe out, try again, breathe in again. You need to practice a new set point, not forever. You don't have to
Mm,
think about breathing forever, but it's like you got to rebuild those brain body pathways.
exactly. But that is all possible. That is all
Yes.
right. And you can't aim for the top of the pyramid, step 5, or the wisdom and the spirituality and the serenity of a Buddha. That's all quite pretty. If you haven't laid a foundation, you will never ever bloody get up there. So, and I love your system. I love your approach that you say so-called safety first, to actually tell your body, hey, hang on, this is the new start for us. This is where we're going to get where we start a new healing approach. But in order to do so, actively choose a time and space where you can create that safety. Later on, no doubt, those of you listening and practicing and who are maybe a bit more advanced, you can use some of these techniques on the fly. You can do them, in a minute before a presentation or before going on stage to present to an auditorium of 100,000 people, where everyone
Let
would
me
get
say
nervous.
that doesn't require you to be advanced. That's something you can do. You can do any of it on the fly. That doesn't require advanced.
True. Having said that,
Yeah.
if you're starting at a very extreme point, you with your muscle weakness in your early 20s, you with all that fear, no doubt a fear avoidance, no doubt so many other things that were feeding into that chaos that was your life then, to now say, okay, take a deep breath and it's going to be all fine. Yeah, about that.
No, but that's what I'm saying is when we use the somatic safety, we use the body signals.
Right.
Like that's something that can be done to interrupt the loop because you're in this
Correct.
loop like hiccups.
Yep.
And so what I was saying is the body brain signaling is a cool thing because you can do it at I've had patients bedbound, literally can't get out of bed for 5 years. Like I've worked with really, really intensely disabled people, and you can always find a window in with the body.
Beautiful. Beautiful. You can find a window in, and I think that
It's
is
a
the key
window.
here. That's
Yeah, I'm
right.
not saying you change everything, but you get the
Absolutely.
window.
That's exactly it. So,
That's
and
the thing.
that's where the hope is. So,
Yeah.
however long and however bad your situation was, I think there is hope there, and I think there is an amazing degree of improvement possible if you persevere with looking around for opportunities. And I say it so carefully in this way because you are probably, if you have been suffering for a long time, you probably saw many specialists, you probably saw many doctors, many allied health professionals, many
And it's hard
alternative
to have hope
healers.
that the next thing will do anything.
Exactly. And how
Yeah.
many times did I have people coming to me and say, "No, I'm sure there's something wrong. I'm sure there's something wrong. Can I have another MRI?" And then I look at the notes and you have had already 16. Or you have had already been in free pain clinics. Well, hang on, what do you think I can
You
do?
send them for an upright MRI.
Touche, touche. Now I know that. But if
Now
that
you
is
know.
if that is
But
available, if that is
right.
available in your
I
area,
know.
then
I have there's someone in our online group right now who's from Australia, and I guess somebody sent him one of my TikToks months ago, and he's been chronically ill for like 20, 30 years. And he, based on my TikTok, found the one upright MRI in Australia, flew there, got an upright MRI, found out this is what he has. He's in the program now and finally starting to see improvements for the first time in decades. But I will
okay.
say, I don't think that's necessary. Like, because this is something we talked earlier about, like different therapies. You don't want to try them when they're early on because what if it's going to cause a problem? I've never had side effects with this work because it's non-invasive, because
Mm,
it's about working with the nervous system regulation.
mm,
When done correctly, it doesn't, the worst thing that can happen is you exceed your threshold and you flare your symptoms for 24 hours or something.
mm. Yeah.
But you don't. I've had so many people who couldn't access an upright MRI because they're
Mm.
not always nearby. And I'm like, well, try the things. Try these nervous system regulation exercises and reducing the tension in the dural fascial kinetic chain with this fascia therapy. See how you go.
And you took the words right out of out of my mouth, to quote Meatloaf here, because my point is, yes, of course, you could hunt for a diagnosis, and if you have a label where you can say, "Finally, now I know that there's
No.
something," um, yeah, right. Now you've got a label. Now what? So you could argue other way around that a huge, huge amount of underlying reasons will lead the body to respond in a similar way, in a protective
Yep.
way, in an overprotective way, and in a protective pattern, which we have just discussed in depth. So it does not matter if the
How you
reason
got
for
there.
this is exactly that could be a Chiari or whatever else in your affecting the brainstem and the bottom part of your head. It could be systemic inflammation due to all kind of toxins, etc. Now, granted, you want to work with someone who looks at you holistically to actually figure out, is there an underlying reason that we can do something about? So, for example,
Yeah, you
if
want to look at like what's the list of things that could physical, chemical, emotional, spirit, like all
absolutely,
the things that
exactly.
could be contributing to that chronic alarm state. I talked today about the structural when the body is holding tension, and that's a piece that's missed. It is not the whole thing. I know there are a lot of techniques out there where the founder found the one thing that helped them and they go, "Oh, this is a panacea. This is the thing for everything." I am absolutely not saying that. I'm saying this is a thing you're probably missing
Yeah.
on the foundation. But yes, absolutely, we need to be looking at all of those other physical, chemical, structural, all of the things in order to say, why is the body not healing itself? And that's very different than how do I manage these symptoms or how do I fix this pain? It's instead saying, at the foundation, the body is not prioritizing self healing and self
Mm.
regulation. Why not? And
Exactly.
how do we help it do that?
Exactly. Exactly right. And I love that. Absolutely love that. So I see your protocol, not protocol, your approach
My
to
method, yeah.
method, let's call it method like that. Your method as a very sensible and very logical approach to working on the body whilst ruling out other things, whilst supporting the body from a nutritional point of view, from a hydration point of view, from a spiritual point of view. So these things all are working together. But you have got this big spider web and these thousand different ways how you can tackle your challenging life. I think sooner or later, your method will come in there because if there is a clearly structural problem there and you have not addressed that, then you can do as much of the other things.
You can't red light therapy your way out of stuck fascia.
Yeah,
I
my
mean,
point, my point.
no, I mean, reducing inflammation does reduce fascial adhesions.
Yeah.
So, like, I actually talk about nutrition in the program only in the extent of how it affects cross-linking chemistry and stuck places in the body. So inflammation is part of that. But having a provider who can actually deep dive into your inflammatory profile is really helpful
Mm,
because it is so interconnected.
beautiful.
Yeah.
Wow, Satya, what a deep dive into fascia and the way we can actually sometimes, well, you would argue already about the sometimes, where so often you have seen improvements in cases where so many other people just shrug their shoulders and say, "Look, you just have to get on with life. It's all in your head. It's all in
Yeah, you just
you
have to
know."
accept a life of disability.
Exactly. When in
I
reality, there is actually so much hope out there. I
yeah,
think that is key
I think
message,
it's
isn't it?
the biggest takeaway message is your body's ability to heal is far greater than you've been probably led to believe.
Beautiful.
And I will
Beautiful.
actually say I don't like blanket statements as a whole. I always find like the holes in it, but I will say I have never in my 15 years of clinical practice ever seen someone who didn't get some improvement under my
Mm,
care with
beautiful.
these methods.
Beautiful. Satya, you're an amazing woman. If people want to know more about you, where can they find you?
They can find me, like I said, I make a lot of free content on TikTok and Instagram. I'm on both platforms as Dr. Satya Wellness, DrSatya Wellness, Wellness. And you can also, I'm happy to share with you the link to my online platform if you want to post it with this, but
Mm,
also it's on those platforms, like in the bio on my social
Beautiful.
platforms. And that's really the best way. People often will want to reach out to me after I do these shows and say, can I come see you? How can I be your patient?
Yeah.
And to that, I always say, look, I created this because I wanted the investment to be so super low, so it's accessible to most people. It's literally the best place to start because I'd say 50 to 70% of your stuck things and nervous system dysregulation, you can reduce and correct on your own at home. And then inside the program, there's directions for like how to find providers, how to tell who are the right people for you and in what order and what questions to do to make your team. And if somebody really needs my one-on-one help after that, I'm happy to help. But I always say, join that program first because it's literally less than the cost of a single session to a massage therapist per month. And that will help greater than the expense of coming and flying to see me right now.
Absolutely. Brilliant.
Yeah.
Guys, look down there into the description of the YouTube video and of the podcast because all of the information is down there. Whilst you're down there, please press the like and subscribe button because this way we trigger the algorithms and more people get exposed to this content. And I strongly believe that we are here to learn, that by learning and then implementing those things we have just been newly exposed to in our daily lives, we become better humans. And by us become better humans, we can make this world a better place. But we have to start with us. You can't just go out there and go crazy when you are yourself just barely hanging in there because there's so many things wrong with you. And so, yeah, work on yourself. And if indeed some of the symptoms and some of the story that you have heard today sounds rather familiar, well, what more? What have you got to lose? And more importantly, what could you possibly gain when we say both Satya and me strongly believe there is hope and you can improve your plight, however long it has been the way it was. The past does not equal the future. So let's work together. Let's go out there. Let's connect and let's make this world a better place. Satya, you're an amazing woman. Thank you very much for your passion, for your time, for your effort.
Thank you so much. I'm really grateful to you and this platform for helping make the world a better place and share these resources far and wide. So
absolutely. And you guys out there, live with intention. Bye.
I never give up. I never give up. I never give up. Turn around.